Dave Popkin back with you here at Prudential Center in Newark. Seton Hall trailing Butler at the half, 48-20. Tonight's game is presented by the Mental Health Association, who reminds you that mental illness is real. More importantly, recovery is possible. Seton Hall Athletics would like to thank the Mental Health Association for their continued support of Seton Hall Athletics. And my guest now is Arielle Scarpelli from the Mental Health Association. She's a program director for Mobile Crisis Outreach Response Teams, MCORT, in Essex and Hudson for the Mental Health Association. And Arielle, welcome to The Rock.
Thank you. Thank you for having me.
I understand we have a mutual friend, your father.
Yes.
Dr. Joe Scarpelli was the longtime mayor of Nutley, longtime commissioner, and mental health advocate as well.
Yep.
I've talked to him a lot over the years. For those that don't know, I'm also the president of Nutley Family Service Bureau, which provides about 10,000 mental health sessions per month, and we've coordinated with MHA over the years. Let's talk a little bit about the program right in front of us that you've been working with, 988 MCORT. What does that involve?
So Mobile Crisis Outreach Response Teams, or MCORT, is part of the continuum of care for individuals who contact the 988 Suicide and Lifeline Center. I want to start by providing some information about 988 because although MHA does not operate the call center, it's directly related to our program. So 988 is the 3-digit dialing code that is available 24 hours a day, 365 days a year. And the individuals can call, chat, or text in and be connected to a trained crisis counselor. When someone reaches the Lifeline Center, the crisis counselors will be conducting an assessment and determine if the individual would benefit from in-person support. And if they would, then that's when we get dispatched. We're going to be dispatched 24/7, 365 days a year in Essex and Hudson Counties. And we have 11 teams throughout those two counties where they're made up of teams of an individual has lived experience, so their own recovery from mental health or substance use, as well as a bachelor's level professional and a licensed clinician.
The demand for mental health services really over the past couple of years, I think since COVID, has risen in my experience. Has it risen with your particular program?
Yeah, for sure. I mean, this is definitely a program that's supposed to fill a gap. There's nothing right now that goes out to individuals who are immediately that don't have a severe and persistent mental health condition. So this is a really easy, accessible way for people to receive services that are calling in, chatting, or texting into 988 for the first time and are looking to receive that connection to mental health and substance use services.
So when somebody calls in, what are some of the goals of the program? Like, are you trying to refer, or are you trying to decide if you have to go right to the person? How does it work?
So when they call the Lifeline Center, they're kind of making their own assessment, and we're going to go out. When we go out, our primary goal is to really de-escalate the situation, make sure the person feels heard and supported. We're also going out without police, so we're avoiding unnecessary law enforcement and incarcerations. We're trying to keep the person in their home so they're not hospitalized unnecessarily as well, but mostly trying to link people to services as fast as possible, because if you've ever tried to connect someone to mental health or substance use services before, it could be weeks upon weeks to get into treatment. So we're working on getting same day and next day appointments. Also, our goal is to just get the word out there right now about 988. So if you hadn't heard of 988 before today, I'm sure you're going to start seeing it around. You might see billboards, you might see bus ads. I actually just was getting lunch recently, and I happened to park in front of a sign that said Hope has a new number, 988, call, text, or chat. And I just thought, what a great thing to have, like, in a parking lot. It could be the worst day of your life, and you walk in and you see this sign, and now you know that there's hope and there's somewhere there to help.
Yeah, such an important service. And Arielle Scarpelli is with us here from the Mental Health Association, longtime sponsors of Seton Hall. We help them get the word out about their programs. Now, where is your office located, and what is the region like that you guys serve?
So MCORT will be available in every county in New Jersey. MHA specifically is Region 9, which is Essex and Hudson. Our offices are located centrally in each of the counties. Our Essex office is located in West Orange, and our Hudson office is located in Secaucus. But realistically, the best way to get in touch with us is through the 98 phone line.
So how do people learn more about the program? Is there a website, et cetera?
Absolutely. So information about 988 can be found on the Substance Abuse and Mental Health Services Administration website, which is samhsa.gov/mental-health/988, as well as our Mental Health Association's website, which is mhainspire.org.
So mhainspire.org is kind of a central clearinghouse where people can go and find different services, including this one. Now, are you a big basketball fan?
I'm becoming one.
That's a good answer. Well, this is not the night to become a big fan. A little bit of a lopsided first half. What's your background that led you to this work? Like, what's your why?
Yeah, I got into this field. I actually wanted to do mostly substance use services. I got my first job actually at the Mental Health Association 11 years ago, and I never left. I say I'm an MHA lifer. I love it at that organization. I think there's just so many opportunities. We cover so many different types of services. I then started working in our homeless outreach services for like the last 6 or 7 years, where we were encountering a lot of crises, and started to work with co-response programs. So we have a couple of clinicians that sit inside police departments. So when this opportunity for MCORT and 988 came about, it kind of was a natural transition for us.
Well, congratulations. You're doing vital work. We really appreciate that and appreciate the partnership of the Mental Health Association. It was good to meet you.
Good to meet you, too. Thank you.
All right, good stuff. That's Arielle Scarpelli joining us here at the half at Prudential Center. Butler leading Seton Hall 48-20. We're back with the second half and some scores in just a moment. From Learfield, this is the RWJ Barnabas Health Seton Hall Pirates Sports Network.